Hi, everyone. I just want to welcome each and every one of you to this channel today. If you have not subscribed, I want you to hit the red button and subscribe. Hit the bell also, so whenever I download a video, you can get notification. So today's topic, like you see, what do you like about being a nurse? So somebody asked me this question. So I'm going to try as much as I can to answer it, and I want to be very, very brief in this video. Um, Being a nurse is one of the best things I would say that has happened to me in so many ways. I learned a lot about nursing, or about the human being, about behavior, about everything about to do with human being, the way we behave, the why we do the things we do. I learned a lot about medications, the side effects. So to me, it was a privilege for me to be a nurse. So I really enjoyed it when I see people on that bed, and I have to be the one to take care of them. I feel very honored to be the one that they trust their lives and their health into. Um, so it's been a very great journey for me, and I really cannot trade anything for it. Secondly, it's one of the most respected and honest profession, and a lot of people trust nurses. A lot of people trust the judgment of nurses in the healthcare industry. I've heard people, even though you are in the room, the doctor come in and talk to them about their health, about what is going on, about everything. They still pull you by the side, and sometimes some of them ask you, what do you think? What do after the doctor finish, well, how long do you think this is going to happen? So the nurses are the people that I don't know whether they find more confident, they feel freer to come to. So I have experienced that, and I have seen that. So the nurses, probably everybody see the doctors like up there, but the nurses come at the level of the patient at that point that they needed help, and they are compassionate, they are kind, and they are very understanding, and they are smart. So I'm not saying that the doctors are not smart. Um, don't quote me on that. But I have seen so many patients, come in, and they are very grateful. And another thing that I enjoy being a nurse is going into the grocery store. Like, I have gone to Walmart several times, and I ran into my patient or my patient family, and the joy and the hug, and so it is unbelievable. So sometimes even the color or of your skin or anything doesn't even have to do with this. You see somebody that you've taken care of, they come in and give you this good hug, and sometimes I'm like, I don't even remember this person. What is going on? Who are you? And, oh, you are my nurse. You work in so and so place. You were my nurse the other day. You are the nurse that took care of my mom. So such gratitude, such expression, it's priceless. It's priceless. I cannot ask for more than this. Even though there are days that we get some bad patients on the floor, and some people that are not grateful, or some people that are just drug seeking or behavioral issue. But the number of people that are grateful, kind of does it all for me. I remember standing on the aisle and this old lady came in and even know my name, Ife. And I was like, wow. I was so ashamed to say that, ma'am, I'm so sorry. Who are you? And she told me who she is. And oh, you took care of my mom, or you were the day I had a surgery, you were the nurse that was on my side. I know I was so grateful. I was so happy. And it was such a wonderful blessing. So I wouldn't trade it for anything. The days that I don't want to be a nurse. There is no day that I don't want to be a nurse. The only days that I don't want to be a nurse is the days that we are short on the floor, that you have to get more patients, you have to do more things. But, being nurses, we still get it done. I think um, we are created to be strong, and at the end of the day, things get done. So that is the only day I can say I wouldn't want to be a nurse. But other than that, there is no day I wouldn't like to be a nurse. Second, I think thirdly, you job is all out there. Since I became a nurse, I have never been out of job. You can go from one job to the other. The problem is, will you stay? Because by the time some of us see another something more attractive the other end, people tend to run away. So being a nurse also guarantee you have a guaranteed job. There is always job for you. So I don't remember like looking for a job except when I just graduated. That some people didn't want. I was still working as an LVN, but I except that time when some people didn't want to hire me because I wanted to go to the hospital and they said I didn't have the experience. Other than that, and that wasn't long. It was I think between 3 to 6 months. So I got a job, and since then I haven't had any issue not having a job. So that is another reason why I would say being a nurse does it for me. So it's at least knowing that you have a guaranteed job and all that. So I hope I answered this question for you. Uh, well, it's been wonderful, and I couldn't trade anything for it. I don't think I can do. I can be any other thing. If say today, okay, choose what else you want to be, I will still say I would like to be a nurse. And then there are so many areas you can go in. And if you don't like the bedside nursing, you can go the other way. There are so many. I did a video on that. So yeah. So thank you, and I hope you come and join us. As many we need as many nurses as can come in. The baby boomers are getting older, and some of us even are getting older too. We are about to retire soon in a couple of years more, so we will be needing your services, and we may not be able to be running all the codes and doing all that kind of stuff again. So we look forward to as many. I hope this helps people who are making a decision to get into the profession. And this is just in my own opinion. There are so many other reasons that you can get to why you can be a nurse. So many people have their own opinion. So leave me a comment what you think, what's your reason for being a nurse, or what you like about being a nurse. All right? Or what made you join the profession, or what made you go back to school. Some people went back to school. This is a second career for them. Just like me, it's a second career because this was not my first degree. So so let me know why you like being a nurse. Thank you. Bye.